Hello there. My name is Nicholas Verlanic, along with my partner Jason Nielsen. We are representing the University of Montana in Missoula, Montana, as well as the School of Integrated Physiology and Athletic Training. Today, our poster presentation is on comparing skin temperature rewarming times between cold water immersion and crushed ice packs. So, as we all know, cryotherapy is a commonly used technique in an athletic training room or in an injury management type scenario. So, we wanted to take a look at these two common cryotherapies, cold water immersion and crushed ice pack. We wanted to compare the difference between the two in initial skin temperature after a common treatment time, as well as see which one had a faster rewarming.
So, as an intro, a lot of evidence suggests that cryotherapy is one of the most effective treatments for acute and subacute care of musculoskeletal injuries. And this is due to the cooling effect of making it like an analgesic effect, which is when it's cooled to below 56.5 degrees Fahrenheit. And anything past 41 degrees Fahrenheit would produce a metabolism skim temp, and it's unclear on how long these effects last through cryotherapy application. Current research does not conclude which cold therapy technique is most beneficial for acute injuries. Although research is limited, it's assumed that the cooling effect leads to a greater metabolic suppression and greater analgesic effect. This suggests that modalities that create lower tissue temperatures are most effective in subacute and acute care of musculoskeletal injuries.
So our methods for this study was we took a convenient sample of 7 healthy college-age students. We had 2 males and 5 females with an average age of 22 years, with an average height of 66 inches and an average weight of about 140 pounds. So our study design was repeated measures design. We used the subjects. They completed both trials with a week separating each trial. The 2 trials included one 30-minute treatment of a crushed ice pack, as well as a 10-minute treatment of cold water immersion. So 4 procedures, each patient's sinus tarsi was marked with an X. This was used because it houses the ATFL, which is a common site for pain during lateral ankle sprains. We recorded 3 baseline measurements without any application of treatment. And this we just taken 3 times to reduce human error. Then following each treatment, we used a Ryobi infrared thermometer to take skin temperatures again at immediately post-treatment, 5 minutes post-treatment, and 10 minutes post-treatment. Averages were taken at each measurement to reduce human error. Our data analysis we used Microsoft Excel to calculate our descriptive statistics of height, weight, age, as well as their skin temperature measurements. We then used a 2x4 repeated measures ANOVA using SPSS to calculate the mean difference in skin temperature immediately after treatment, 5 minutes post-treatment, and 10 minutes post-treatment for both cold water immersion and crushed ice packs. Our significance was set a priori at p is equal to 0.05. Our results from the repeated measure ANOVA showed that there was no statistical difference, hosting a p-value of p is equal to 0.2. However, there was a main effect for time whereby all trials resulted in similar amounts of skin temperature cooling. We then followed up each with a comparison at each time point, and this was also revealed to have shown no statistical significant difference for our baseline skin temperature following each treatment, as well as 5 and 10 minutes post-treatment, suggesting that each modality cooled the skin temperature similarly. And as you can see by our graph, there is really no huge amounts of difference. Cold water immersion cooled slightly lower, not significant, as well as rewarmed to a higher temp faster. Again, no significant difference. Our study again showed there was no significant difference between the two therapies, as well as both therapies reached therapeutic range, achieving the analgesic effect. These effects were short-lived, and tissue rewarming outside the therapeutic range was within 5 minutes post-treatment. As for some things to talk about, we used elastic wrap to hold the crushed ice pack on the skin, whereas it is shown in the evidence that using an elastic wrap rather than plastic wrap produces greater cooling as well as slower rewarming. Another thing that we could have looked at would be an actual intramuscular temperature rather than skin temperature, and this would therefore help us determine the effects of the thermal gradient, which is where as the top layers cooled, the under layers cooled a little bit. When the treatment is removed, the under layers still continue to receive cooling that's moving down the chain.